So this session is about understanding what are the instruments which are required for dissection. Okay, in your dissection kit there are various instruments about which you have a lot of confusion that which instruments are to be taken and what are their names and how do we have to use them. So this small video is for that purpose. So you must understand first that as you are purchasing the dissection boxes, you must confirm that what are the various instruments which are present in your dissection kit. So first of all, this is the faucet. As you can see here, its edges, distal edges are plain. So this is a plain faucet. Okay, this is a plain faucet. Another faucet we have, which has, you can see at the distal end there are tooth-like elevations. So this is called as toothed faucet. This is the second member of your dissection kit. Member of your dissection kit is long scissors. This is a long scissors. There is often a confusion that you always get straight or curved scissors. We don't require curved scissors usually during our usual dissections. Just usual dissections, we don't require this curved scissors. This is a curved scissor. We don't require this. Also, this kind of curved scissor, we don't require it. Okay. We require the plain scissor. See, this is a plain scissor. How do we handle the scissor? Usually at our homes and up till now we usually handle it like this. No. In the dissection hall we handle it, please cut it. Dissection hall we handle it with our thumb and our ring finger. No, this is our ring finger, right? So we handle it like this and we use it like this, keeping it open like this, and this is how we use the scissors. Okay, we will talk about it later. So another member of the dissection kit is the scissors. This is a big and plain scissors. You can see that its one end is blunt, another end is pointed. Okay, this has to be remembered because if both the ends are pointed, that is not of much use. You will see why. Another scissor which we have is the small scissors in our dissection kit, and in case of the small scissors, again we are handling it the same way as I told you, right? We are using the thumb and the ring finger, and both its apexes or the distal ends are pointed. Okay, this is the small scissors here. Then, and another most important member of the dissection kit is the scalpel. Okay, scalpel, what you will get is you will get a scalpel handle and a scalpel blade alag se. Okay, so these are the things which we need in our dissection kit, and we should remember this, and we should check before we take the dissection box, so that unnecessarily we should not pay for the things which we do not require in our dissection box. Now the next thing is how to use these dissection instruments. Okay, so first we will see that when we get the scalpel, we have to be very careful that how we put the blade of the scalpel in the dissection hall. Most of the time, most of you get injured while putting the blade of the scalpel. Okay, so see the method how we put the blade of the scalpel. We have to take out the blade like this. Okay, and then we have to, what we have to do is, you can see that this blade has an oblique base. Okay, this oblique base coincides with the obliquity of the base at the handle. You can see this is the oblique क्या बोलते हैं इसे, groove in the blade handle of the scalpel. So how we put it? We will put the blade, we will insert it in such a way that, see, now this groove has broad part and narrow part. Okay, broad part. So what we will do is we will put the blade slowly through the narrow part. We will put it slowly through the narrow part. We have to be very patient when we are doing it, because what happens is थोड़ा सा भी गड़बड़ से हमारा हाथ में, बस थोड़ा सा ये अटक गया, उसके बाद हमें छोड़ देना. हमें उसे रगड़ते नहीं रहना है कि अंदर तक उसे घुसाएंगे. उसके बाद फिर हम इसे नीचे रखेंगे और अपने आप ये अंदर चला जाएगा. So without getting injured, we will be able to fix the blade of our scalpel into this handle of the blade. This is how we have to do. Then how do we have to use this scalpel? We have to use it the way we handle the pen. Okay, don't use it like this. ऐसे, ये कोई बात नहीं है, ऐसे नहीं use करना. We have to hold it like a pen, right? And then we have to give the incision like this. The incision should not be very deep because the thickness of the skin is only few millimeters. You know, so you first see a normal scale and just get an idea that how much is like 1 or 2 millimeter. That much deep should be the scalpel. It should not be ऐसे पूरा piercing नहीं होना चाहिए. And hence we are handling it like a pen. So when you are writing with the pen, you are not holding it too hard to write. No, you hold it very gently and give a incision like this. This is how we use the scalpel. Once we have given an incision, then what we do is, I will just show you with the help of a paper. Yes, supposing we have given the incision on this skin like this. Okay, we have given the incision. Now this incision which is given in the skin, you will get a mark here, and then what you will do is, with the help of the toothed forceps, okay, with the help of the toothed forceps, you will hold the skin with the toothed forceps and pull it towards you. Okay, pull it towards you. As you pull the skin, you will see that between the skin and the underlying fascia, there will be a stretch of the fascia. So what you have to do is, to reflect that skin flap, you will have to use the point of the scalpel towards the upper side, not keeping low, but towards the upper side, to remove it or detach it from the remaining fascia. Like this you have to reflect, and then further you can, suppose इतना तुम्हारा detach हुआ, तो अब इसके बाद तुम अंदर थोड़ा स्किन को अंदर करके यहाँ से पकड़ो और फिर स्ट्रेच करो, और फिर जो तुम्हारे ये जो स्ट्रेच लिगामेंटल फेशियल लिगामेंट्स हैं उनको तुम कट करो. ओके, दिस इज हाउ. सो मोर वी विल अंडरस्टैंड व्हेन वी विल डू द practical in detail in the dissection hall, but this is how you have to use the toothed forceps and the scalpel initially. After that, this is a plain forceps. Now plain forceps, we use it in many ways. Plain forceps, when once we have reflected the skin, after that if we use the toothed forceps and the scalpel, we will be injuring the underlying vessels and the nerves. So that time we do not have to use these sharp instruments which may destroy the structures there. That time we have to use the plain forceps. So for handling the vessels, for handling the nerves, that for cleaning the fascia, okay, cleaning the fat in the fascia, we can use the posterior part also. These are the practical tips. This no one will tell you, no book is telling this, but when we use it like this, which we have learned from our seniors at BJ Medical College Pune and in JJ. So when we do it like this, we get good results for clearing the fat which is lingering onto the structures like vessels and nerves over there. Then once we have reflected the skin, underlying the skin there is fascia. To clear the fascia, what we do is, we hold the we take a toothed forceps, we hold the deep fascia with the toothed forceps, and then what we do is, we give a nick over there with the help of the scissors. And I have already told you how we handle the scissors, with the help of our thumb and our ring finger. And the peculiarity of using the scissor in dissection is that most of the time we are using the scissors as in an expansion mode, not for the cutting, not in the cutting mode, but in the expansion mode, so that by taking the scissors under the fascia in the nick which we have given, we can expand the fascia like this, and we can clear the structures which are present in the superficial fascia. So this is why we use the scissors most of the time. Okay, and then we have the small scissors. The small scissors can be used when we are doing the dissection of the small vessels and small nerves which are very thin and which should not get cut. So this also we use. Yes, one more thing which I forgot is that when we are using the scissors, that time the blunt end should be towards the structures, okay, and point end towards ourselves, because the blunt end जो है, that will not destroy the structures such as vessels and the nerves. So we keep it down. Okay, so this is one thing which we have to remember. I think I have covered most of the points, and if there is anything remaining, I will cover in the next session. Thank you so much.